Okay, cool. We still have a couple more things that I want to touch on here that you've really highlighted again. When we don't have sleep, our risk of these things increases. People don't think about this often, but psychiatric illnesses, depression, anxiety, bipolar disorder, and even suicidality, right? Talk to us about that. You mentioned that with also the first responders. So tell us how our risk of depression, anxiety, all these mental health disorders increase when sleep is not dialed in.
Yeah. So big picture view, sleep, not having enough sleep, having inadequate sleep contributes to nearly every major psychiatric illness: depression, anxiety, bipolar disorder, suicidality, schizophrenia, etc. And there's a lot of data on this. There was a research team in Italy that was working with bipolar patients. And after just one night of inducing sleep deprivation, a large portion of these subjects spiraled either into a manic episode or a depressive episode. And I think, what we know is that part of what's happening is that, there's a lot of communication and signaling that's happening in the brain. The prefrontal cortex, which is responsible for rational thought, for logical decision making, is normally coupled to the amygdala. And the amygdala is our reptilian ancient brain, which basically has three choices: fight, flight, freeze, right? It's our sympathetic nervous system, signaling for emergencies. So that coupling is usually nicely in place. But we see that when there's sleep deprivation, that balance is broken down, right? And so in sleep deprived individuals, there's about a 60% increase, some studies have shown, of amygdala activation compared to individuals given a full night's sleep. And this pretty strong coupling between these two countering brain centers is weakened. And you can also see a lot of emotional lability, right? And I think this is part, not just being tired, but like you're crabby, you're grumpy, you're like, I can't quite deal with anything more on my plate right now, right?
Basically, you don't sleep. You kind of become an asshole to the people around you, including the people that you love.
Absolutely. And you don't feel good. You just feel like blah, like this is not a good day. Like I can't wait to try to get back in bed and do over, right? Um, but there's a researcher over at UC Berkeley, Dr. Allison Harvey, who's done a lot of work with cognitive behavioral therapy for insomnia, CBTI, which is really important for people to know about, CBTI, in the treatment of a lot of different psychiatric conditions. So just getting these people to sleep better by improving their sleep quantity, by improving their sleep quality, their sleep regularity. Dr. Harvey's protocols have really shown a lot of improvement in symptoms of people with depression, with bipolar, with anxiety, even suicidal ideation, right? So really, really profound.